Chapter 7, Pre-Examination and Pre-Analytical Complications. By the end of Chapter 7, you should be able to describe pre-analytical pre-examination complications related to blood collection procedures and effect on patient safety. Explain how to prevent and or handle complications in blood collection. List at least 5 factors about a patient's physical disposition, for example, makeup, that can affect blood collection. List examples of substances that can interfere in clinical testing of blood analytes and describe methods used to prevent these interferences. Describe how allergies and mastectomy, edema, and thrombosis can affect blood collection. List pre-analytical complications that can arise with test, request, and identifications. Describe complications associated with tourniquet pressure and fist pumping. Identify how the pre-analytical factors of syncope, petechiae, neurological complications, hemoconcentration, hemolysis, and intravenous therapy affect blood collection, and describe methods used to prevent these interferences. Overview. Pre-analytical pre-examination variables important to healthcare workers: patient assessment and physical disposition, test request, specimen collection, specimen transport, specimen receipt in the laboratory. Diet. The term fasting refers to no food or drinks except water. The required time period necessary for fasting depends upon the test procedures to be performed. Average is 8 to 12 hours. Before collecting a specimen, the healthcare worker should ask the patient if he or she has had anything to eat or drink. If the patient has eaten recently, but the physician still needs the test, the word non-fasting must be written on the requisition and or directly on the specimen. If asked to explain fasting restrictions to a patient, the instructions should be thorough and clear, with emphasis on the important points of the procedure. Obesity. Obese patients generally have veins that are difficult to visualize and or palpate. If the vein is not entered when first punctured, the healthcare worker must be careful not to probe excessively with the needle. Longer needles are available for collections from obese patients. Damaged, sclerosed, or obstructed veins. Obstructed or occluded veins do not allow blood to flow through them. Sclerosed or hardened veins are a result of inflammation, drug use, and disease. Patients' veins that have been repeatedly punctured often become scarred and feel hard when palpated. Because blood is not easily collected from these sites, they should be avoided. Allergies. Chlorhexidine has been used as an alternative to decontaminate skin for patients who are allergic to iodine, alcohol, or other solutions. Latex-free tourniquets, gloves, and bandages must be used for patients who are allergic to latex. Allergic reactions in blood collection. Check for color-coded armbands or posted signs indicating specific patient allergies. Mastectomy. Patients who have undergone a mastectomy, for example, a surgical removal of the breast, often have resulting lymphedema on the site of the surgery. The fluid in the area may make the patient more prone to infections. The arm on the side of the mastectomy must be protected from cuts, scratches, burns, and blood collection. Edema. Abnormal accumulation of fluid in the tissues. Swelling can be localized or spread over a larger area of the body. Veins in these areas are difficult to palpate or locate, and the specimen may become contaminated with tissue fluid. Thrombosis. Thrombi are solid masses derived from blood constituents that reside in the blood vessels. A thrombus may partially or fully occlude or close a vein or artery, and such occlusion will make venipuncture more difficult. Burned, scarred, or tattooed areas. Burned areas are very sensitive and susceptible to infection. Veins under scarred areas are difficult to palpate. Collecting specimens from these sites can be very painful. Tattoos contain dyes that may interfere with laboratory tests. Tattooed areas are susceptible to infections and impaired circulation. Vomiting. Have the patient take deep breaths and use a cold compress on his or her head. Follow the healthcare facility's protocol. Contact the phlebotomy supervisor and patient's physician about this complication. Identification discrepancies. Improper identification is the most dangerous and costly error a healthcare worker can make because it can be life-threatening. Identification should include a match between the patient's identification, his or her verbal confirmation, and the test requisition. Discrepancies must be resolved before the collection of any samples. Identification discrepancies. Improper identification is the most dangerous and costly error a healthcare worker can make because it can be life-threatening. Identification should include a match between the patient's identification, his or her verbal confirmation, and the test requisition. Discrepancies must be resolved before the collection of any specimens. Time of collection. Early morning specimens are most commonly requested in hospital settings because a fasting specimen is preferred. If a healthcare worker is running late, the specimen might be collected after an inpatient has eaten breakfast and would require a special notation about the non-fasting condition. Requisitions. Checking the requisition to match the laboratory tests requested with the appropriate type of collection tube is essential to minimize the amount of blood collected from each patient. Tourniquet pressure and fist pumping. Laboratory test results can be falsely elevated or decreased if the tourniquet pressure is too tight or is maintained too long. The pressure from the tourniquet causes biological analytes to leak from the tissue cells into the blood or vice versa. Some enzyme levels can be falsely elevated or decreased because of tourniquet pressure that is too tight or prolonged. Pumping of the fist before venipuncture should be avoided because it leads to an increase in the plasma, potassium, lactate, and phosphate concentrations. Reducing recollections for blood. Not inserting the needle deep enough, inserting the needle all the way through the vein, holding the needle bevel against the vein wall, losing the vacuum in the tube. During the needle insertion, the gloved index finger can be used to help locate the vein. The needle may need to be moved or withdrawn somewhat and redirected. The only acceptable redirections are backward, forward, and in a straight line. Needle positioning and failure to draw blood. In Figure A, this is the correct insertion technique. Blood flows freely into the needle. Figure B, bevel is on the vein upper wall and does not allow the blood to flow. Figure C, bevel is inserted into the vein's lower wall and does not allow the blood to flow. Figure D, needle is inserted too far. Figure E, needle is partially inserted, which causes blood leakage into the tissue. And Figure F, a collapsed vein. Reducing recollections for blood. On occasion, a blood collection vacuum tube will have no vacuum because of a manufacturer's error, age of the tube, or tube leakage after a puncture. Needles for evacuated tube systems have been known to unscrew from the barrel during venipuncture. If this happens, the tourniquet should be released immediately and the needle removed. Fainting, also known as syncope. Syncope is the sudden loss of consciousness caused by a lack of oxygen to the brain. Results in an inability to stay in an upright position. Fainting, syncope, low blood glucose, heart ailments, rapid breathing, mental conditions, medications. Ask ambulatory patients if they tend to faint or if they have ever previously fainted during blood collections. If so, they should be moved from a seated position to a lying position. If a seated patient feels faint, the needle and tourniquet need to be removed. The patient's head should be lowered between his or her legs, and the patient should breathe deeply. The healthcare worker should stay with the patient at least 15 minutes until he or she recovers or until a nurse or physician takes over. A wet towel gently applied to the forehead or a glass of juice or water may help the patient feel better. Hematomas. Hematomas can occur when the needle has gone completely through the vein, the bevel opening is partially in the vein, Not enough pressure is applied to the site after puncture. If a hematoma begins to form, the tourniquet and the needle should be removed immediately, and pressure should be applied to the area for approximately 2 minutes. If the bleeding continues, a nurse should be notified. Patient's hematoma after venipunctures here's an example. Petechiae, small red spots appearing on a patient's skin, indicates that minute amounts of blood have escaped into outer skin layers. May be a result of a blood clotting abnormality and should be a warning that the patient's puncture site may bleed excessively. Here is an example. Excessive bleeding. Patients on anticoagulant therapy and/or high doses of arthritis medication or other medication may bleed for a longer period. Pressure must be applied to the venipuncture site until bleeding stops. Neurological complications. If the healthcare worker accidentally inserts the needle all the way through the vein, he or she may hit a nerve below the vein. The patient will most likely have a sharp electric tingling and painful sensation radiating down the nerve. The tourniquet should be released immediately, the needle removed, and pressure held over the blood collection site. An incident report on the occurrence should be completed and given to the supervisor. Seizure is a rare complication. Immediately release the tourniquet, remove the needle, and move the patient to a lying position if they have not fallen already. Attempt to hold pressure over the blood collection site and call for help from the nursing station. No attempt should be made to place anything in the patient's mouth unless the healthcare worker is experienced and authorized to do so. Hemoconcentration. The increase in red blood cells and other cells and solids in the blood is caused from loss of fluid in the surrounding tissues around the venipuncture site due to several factors: prolonged, for example, longer than 1 minute, tourniquet application, massaging, squeezing, or probing a site, long-term intravenous IV therapy, sclerosed or occluded veins. Intravenous therapy. Patients on intravenous IV therapy for extended periods often have veins that are palpable and visible, but damaged or occluded or blocked. The arm with the IV line should not be used for venipuncture because the specimen will be diluted with IV fluid. Sometimes the nurse or the physician can disconnect the IV fluid and collect blood directly from the line already inserted. The first few milliliters of specimen should be discarded to remove the IV fluid. A note should be made on laboratory requisition that this step was performed. Hemolysis. Results when RBCs, red blood cells, are lysed or destroyed. Hemoglobin is released and serum or plasma, which is normally straw-colored, becomes tinged with pink or red. Can be caused by improper phlebotomy techniques, using a needle that is too small, expelling the blood vigorously into a tube, shaking or mixing tubes vigorously, performing blood collection before the alcohol has dried at the collection site, pulling a syringe plunger back too fast. May also be the result of physiological abnormalities. Hemolysis causes falsely increased results for many analytes. Hemolysis also shows falsely decreased RBC count, hemoglobin, and hematocrit. Collapsed veins. Veins collapse when blood is withdrawn too quickly or forcefully during venipuncture. Veins of geriatric patients. A collapsed vein should not be probed with the needle. Turbid or lipemic serum. Turbid serum appears cloudy or milky, can be the result of a bacterial contamination or high lipid levels in the blood. Documentation about the appearance of the serum or plasma may be useful to the physician. Improper collection tube. Learn which common laboratory tests require which collection tubes. Be familiar with how and where to seek information about test and tube requirements. Collapsed veins. Veins collapse when blood is withdrawn too quickly or forcefully during venipuncture. Veins of geriatric patients. A collapsed vein should not be probed with a needle. Turbid or lipemic serum. Turbid serum appears cloudy or milky, can be a result of bacterial contamination or high lipid levels in the blood. Documentation about the appearance of the serum or plasma may be useful to the physician. Improper collection tube. Learn which common laboratory tests require which collection tubes. Be familiar with how and where to seek information about test and tube requirements. We have reached the end of Chapter 7. Thanks for watching.